From the outside, it may seem like this young adult really isn't trying, that they're lazy, that they're unmotivated, just unwilling to grow up. But what's happening underneath the surface? They're trying everything that they can in order to keep things together. But with missing pieces, an unsteady foundation, and an unclear blueprint on how to move forward, this isn't being lazy. This is survival. And this is exactly what a lot of young adults who are neurodivergent are going through right now. So today, let's talk about why young adults aren't launching. If you're a parent of a young adult who seems unable to move forward, whether that's getting a job, going to college, or just moving out, feelings that may be coming up for you could be being frustrated, confused, or even scared. And you may have heard the phrase failure to launch. But what does that actually mean? And what's going on underneath the surface? Today, we're going to unpack several different things. What is failure to launch and why it's not laziness? Why it's especially common in autistic and ADHD young adults? The most common family patterns that keep people stuck and in place? And what real support looks like without pressure, shame, or panic. And I want you to stick around to the end of this video because I'm going to share one mindset shift that's going to completely change how you approach your young adult. Hi, I'm Dr. James Thatcher. I'm the clinic director here at Forest Psychological Clinic in Portland, Oregon. And I specialize in working with teens, young adults that are neurodivergent, to where they're on the autism spectrum or ADHD or what have you. And I've worked with lots of different families that are going through this transition, this phase in life. And this can be quite difficult, especially when neurodivergence, trauma, and burnout are a part of the picture. Let's take a closer look on what's really happening when someone isn't launching and how you can support them without pushing them away. So what is failure to launch? Failure to launch is not a clinical term. It's not in the DSM, but it's a term that describes usually young adults between the ages of 18 and usually 30 that seem stuck and overly dependent. It might look like living at home with no clear plan on how to move forward, taking on jobs, classes, and then dropping them or quitting them shortly thereafter. It can also look like sleeping all day long and gaming late into the night. It can also look like avoiding responsibilities and isolating from their friends. And of course, struggling with motivation and mental health issues that keep them stuck and in place. But here's the thing that I want you to take from this video is this is not about laziness. It's about readiness. Why are people failing to launch? And people, in my experience, love to jump to conclusions. They love to jump to blaming other people. It's a simple explanation. Everyone wants a simple explanation on why they're not doing something, right? Because they're lazy, they're unmotivated. They're just unwilling to grow up, like we talked about before. But here's the real reasons on what I see why people struggle. Reason number one is executive dysfunction. ADHD and autism make it incredibly difficult to plan, prioritize, and follow through. Reason number two is anxiety, depression, and burnout. After years of pushing through all of these issues, they tend to just hit a wall and get stuck. Reason number three is perfectionism and a fear of failure, to where a lot of young adults will get stuck in the mindset of, if I try and don't make it, then that means I'm not good enough. And they just get stuck in that mindset. and it's hard for them to move past it. Reason number 4 that I see is a loss of personal identity. They've been following somebody else's plans for their lives for so long, they don't know what they really want. Reason number 5 that I see is well-intentioned over-accommodation. So sometimes I see parents coming in and rescuing far too quickly their young adult or their teenager. And what this does, and what this can lead to, is arresting their development to where they should be able to develop a tolerance for feeling uncomfortable. And that means allowing them to be uncomfortable for a period of time whenever these struggles and conflicts come up. So by the time that they reach adulthood, they've learned how to deal with it. It's okay to be stressed out. It's okay to have these feelings of anxiety, but we've got to be able to build up a thick enough skin, enough tolerance to know and trust ourselves that we can deal with it. And the 6th reason that I've seen people failing to launch is cultural and financial barriers. So let's be real. With the way that the economy is, the job markets, college debt, these things are huge barriers in being able to move out on their own. So I want to share a story with you. I once worked with this young adult who she was making really good grades. She had a 3.9 GPA. But when it came time to applying for colleges, she would have a panic attack almost every time that it came up. What it boiled down to, it was that fear of failure that we talked about before. She wanted to be perfect, but she had never done this before. And what a lot of us may know is that when you apply for jobs or college or what have you, is you've got to go through a bit of an ordeal, right? You expect yourself to not do well. If you have that mindset, you're going to do much better, right? So where I can't tell you how many times, especially when I started off in my career, I was awful at job interviews, awful at it. And I failed and I was rejected numerous times in high school and in college. I would apply for jobs and I wouldn't get them. A lot of us have gone through that. But what we learn over time is how to get better, how to grow from our failures, and how to tolerate that distress. That's what keeps us going. It's that growth. But we've got to remember, again, they haven't gone through this and they're afraid of that perceived failure. So learning how to not become afraid and expect it, it's a bit of a mind shift. And you have to keep getting up and doing it in order to get better at it. So let's go over some common signs. These are some red flags for parents to look out for that may indicate that your child is going through a failure to launch. It can look like avoiding the next steps. So whether that's planning for college, applying for jobs, or even avoiding small social plans. Sometimes it looks like that they're starting all these projects, but they're not ever finishing them. You can also see a lot of emotional shutdown, irritability, and a low self-worth. They're going to be talking themselves down quite a bit. When an emotional or stressful situation comes up, they withdraw. Or maybe you're feeling like you're walking on eggshells over the house because they're just so irritable and they'll blow up at you at any moment. It can also look like they're escaping into screen time, substances, or sleeping way too much. And of course, a really big red flag is that they're living at home with no clear timeline on when they're moving out. I once had a patient tell me that they game for 10 hours every day and they hate it. So essentially what was happening with that person is that they're using game time to escape their reality. They didn't want to deal with what was going on in their life. So they're going online, they're playing all of that time and spending all of that time in the game. And what it led to is that they're feeling stuck. And essentially, I see screen time and substances used up to that level as a coping skill. It's a very poor coping skill, but it is a coping skill for them to be able to deal with what's going on. There are better coping skills that are out there. Let me also say that, far better ones. When they get into this loop, it creates a negative feedback loop. So where if you're playing that much, what are you not doing? You're not planning. You're not looking for a job. You're not trying to move out and move on and move up with your life. You're stuck. So why is failure to launch harder in neurodivergent young adults versus neurotypical young adults? ADHD and autism don't just make things harder. It changes how a person experiences the transition into young adulthood. So what does this look like? It can look like executive functioning delays, can mimic immaturity. Mental health concerns like anxiety and depression can often go unnoticed. So with issues like masking or social communication difficulties, it's often harder for neurodivergent individuals to be able to talk about and identify some of these feelings. Another reason on why it affects neurodivergent folks more so than neurotypical is because they've spent years in junior high, high school, masking all of these different issues. And now they're just burnt out. Now that they're faced with life, college, job, moving out on their own without support, it's a lot. It's overwhelming. And of course, social transitions for them are often much more complex, and it can leave them feeling very drained. So what often looks like defiance or not trying is often trauma or burnout. I worked with a young adult one time who said when he was applying for different jobs, he talked about every time that he goes to a job interview, it feels like a performance that he can't get just right. So he keeps failing. Now let's talk about how families get stuck in this cycle. Parents usually want to help, but what may have worked in childhood may not work nowadays. So some common patterns that families fall into is pushing independence before they're emotionally ready, micromanaging, which often creates a lot of shame and resistance, and solving problems for them instead of supporting them to solve it on their own. The goal of all of this is not about control. It's about collaboration and having them feel safe so they can start to grow. What actually helps? What can make a difference to hopefully get them more ready to launch? Number one is emotional safety before expectation. You've got to be able to connect. You can't change anything if you don't first understand it. Two is scaffolding, not shoving. So this means breaking things down into manageable steps. So for instance, I did this with one client to where we just started with walking down to the mailbox and getting the mail. And once that was comfortable, going down to the corner store. So now we're getting out in public. Now they're doing more things. And then we start working on applying for a job. Number three is redefining success. This isn't just about going to college or getting a paycheck. This is about finding purpose and autonomy. Number four is therapy or even coaching that's neuroaffirming. So having a therapist that understands autism, that gets ADHD, and working with your teen or young adult through that mindset is going to be much more effective than a therapist that just sees the behavior. So I've got a quick question. Have any of you guys tried these different things that I've talked about so far? What worked, what didn't work? Make sure to leave a comment down below. You never know. It could help out another family. The term failure to launch makes it sound like your child is failing, when in reality, they're not. Maybe they're taking the time that they need to build the skills in order to move forward. And building takes time, especially in a world that was not designed for them and how their brains work. So if you liked this video, please hit like and subscribe. Got more videos coming out. In fact, I've got another video that I'll do next that talks about some different strategies that families can use to help their child when they're in this phase of transitioning into adulthood.